Hello class, welcome back. Midterm review time. Starting to get a little more creative with my AI generated images for my intro slide. This is a little bit of Superman combined with human anatomy, a component of steampunk in an overall pop art style. So AI had some fun with these AI generated images. Let's get started. So this is all about some, well, somewhat random mnemonics that we can review to be a little spot quiz here and there for your midterm exam. First one, aorta, right? Know your ABCs when we think about the branching of the aorta and how they work. We first have the brachiocephalic trunk, followed by the common carotid, and then the left subclavian artery, so it's your ABCs. Now, when you think about that, you would say, oh, okay, first branch of the aorta, maybe it'll be the brachiocephalic trunk. It's actually not. It's the coronary arteries, as demonstrated here. The coronary arteries left and right, first branch right as the aorta starts before we get up into our ABCs up here. So that's a good little mnemonic. Here's another one here if I overlay just so. There we go. The lingula, where is that located? This is a really easy one. Lingula, left upper lobe, LUL. Pretty straightforward. Easy way to remember that. Related to this, I'm certainly not going to overlay that x-ray because that would be pretty scary if that was mine. Inhale a bite, goes down to the right. The right main bronchus is more vertical, it's wider, it's shorter, and things just sadly tend to lodge right there. And yeah, that does happen. So beware of that. If you're doing your bronchoscopies, go down and to the right to retrieve that object. Next, easy way to remember the order of blood through the heart valves. Just, try it. I dare you. Try pulling my aorta. This is like the Clint Eastwood, make my day. Try pulling my aorta. Tricuspid, pulmonary, mitral, and aortic. Pretty straightforward there. Easy way to remember here is the course of blood flow going through each one of these valves right there. Next, the posterior mediastinum. Well, because we all dream about going on a date when we think about the mediastinum and inner chest cavity organs and body parts. I know that's a little disgusting, but dates: descending aorta, azygous, thoracic duct, esophagus, sympathetic trunk, or if you want to complete the mnemonic and make it a little broader, if you're more unlucky, you got no dates, which is the nodes, the lymph nodes, or the nerve, meaning the vagus nerve. That completes the picture a little more. I like the dates instead of no dates myself. Speaking of the mediastinum, this is like, the best medical joke I know, right? Four birds walk into a bar. I don't mean that. This is not the best medical joke. Try and figure out what this means, and actually it makes more sense more than you think. Here we go. Which birds are we talking about in terms of the mediastinum? The esophagus, the vagus, the azygous, and the thoracic duck. Get it? Yeah, I know that's dry humor, but it works, right? And the duck is even in between the two gooses. The thoracic duct is between the azygous and the esophagus. This is actually pretty cool, by the way. The journal Mediastinum is the official journal. Of course, the ITMIG, which we all know, is the International Thymic Malignancy Interest Group. That is an actual journal cover. So there is some bird relation in terms of human anatomy and mediastinum. Bet you didn't know there was a whole journal dedicated to just the mediastinum. Jumping around here, now we're getting to other parts of the body. This, like I said, this is a nice random spot quiz to see what you know. Tibia versus fibula, which is lateral? This is pretty darn easy. Fibula is lateral, not too hard there. How many vertebral bones? Quick way to remember this. It's the old breakfast at 7, lunch at 12, dinner at 5. It's a pretty famous one that a lot of people know. An easy way to quickly remember those. Yes, it doesn't include the sacrum or the coccyx. You'll have to come up with your own mnemonic. If you do, please let me know. Leave it in the comments. I'd love to share it with my students. How do we memorize bones of the arm? Well, it's hard, right? It's usually really hard to remember these. Well, not really, right? Ulna, radius, humerus, pretty good. Please make cookies. I love that mnemonic. That's great. Phalanges, metacarpals, and the carpals. And damn my pinky. I'd probably be saying more than damn if that was my x-ray. Maybe a couple choice words, but this is an easy way to remember all the bones of the arm, top to bottom. How about perineal versus perineal? Please don't make that mistake. Perineal is on the leg, the nerve, the common perineal nerve. Perineal is up in between the legs. Yes, we're talking about the pelvis, the perineum, and all those structures located in there. I am not showing a picture of the perineum. We're going to keep this clean on this video. So I am replacing that with just a nice, lovely picture of ice cream. Don't make that mistake if you're rotating through OBGYN or ortho on either end, because it sounds kind of funny and they won't appreciate that. All right, relating to the pelvis here, I'm now realizing there's a yellow theme going on. That's a little weird, but apropos here, the sacral innervation, the S234 keeps the P off the floor. The S234 nerve roots, the pudendal nerve, is innervating your, well, sacral area there, and yes, helps control your sphincters in terms of urination. If you wanted to quickly review that, I made a fairly quick video right here, draw the lumbar plexus and then the lumbosacral plexus if you want to do the whole thing. It's a little bit harder than the brachial plexus, but surprisingly, if you just go through it, it's pretty methodical and systematic, and you can get right from top to bottom. So I encourage you to go review those videos. We don't need it for the midterm for my students, but you'll certainly need it in your medical career to be familiar with those. Changing colors here, that's, I think, better. Median nerve, easy way to recognize it. I teach, obviously this is an online class, and if you're doing an online course and doing online videos, this is not relevant to you, but if you are doing dissection, the median nerve is indeed in the shape of a capital letter M. And I wish Cadaver Lab would be color coded. Sometimes you're lucky when they inject dye, they'll inject arterial red and venous blue, but it doesn't show up as clear as red, blue, and yellow here. It's all very similar in color, but once you find that M, it is pretty fascinating. Like, there it is. That's it. Wow, that's the brachial plexus. And then you can track all the other nerves accordingly. How about this? Abdominal wall muscles. Well, it's your spare tire. If anyone ever heard of your spare tire, when this gentleman is very thin. I don't have that thin of an abdomen there. When we collect a little abdominal fat, it's often nicknamed the spare tire. Well, guess what? TIRE, transverse abdominis, internal and external oblique, and the rectus abdominis. They also go in different directions in terms of the muscle fibers, so another way to try and help you remember those if you get the angles going in. External starts from superolateral and goes to inferomedial. The internal goes the opposite way. How about this? Anyone heard of your gym rat and your lab rat? People like going to the gym. Well, there's people who love spending time in lab. You got your lab rats. Left atrium is a bicuspid valve. Right atrium is tricuspid. Pretty easy to remember that. Straightforward as this picture identifies. Tricuspid here, bicuspid there. Continuing down, this one is weird. It is pervasive. You capture it all the time. It's in different review books. I don't know why this mnemonic works. I mean, it does. LR6SO, maybe sulfate, and that oxygen is like not an O2, but an O3 molecule. Maybe all the chemists out there really love this one, and they can bond with this, but if you need a way to remember the muscles here, and this is the O is others, or ocular motor, in terms of all the different muscles there, and this is the directions that they pull. Pretty neat picture here, kind of funky mnemonic, but it works. Okay, next, this is probably the most esoteric mnemonic I've come across in reviewing here. Yeah, I'm not sure if that's a running race or a cycling race. He races until chunky men pee. Fine, if that works for you, great. We are back to our yellow background. How about that? If you're not a cyclist and you Google, gee, how did Tour de France cyclists pee, you realize something you probably did not want to know and never needed to know. I am not including a picture of how they pee, by the way. FYI, I am including a picture of something you also didn't and never needed to know, but it's out there in the veterinary world. I don't know how this came up related to this mnemonic as I was looking for pictures that might work, and I came across all these Tour de France cyclists literally on the bike and, well, yellow slide, use your imagination. But in case you wanted to know the urine output on a daily basis of various domestic animals, there you go. Okay, out of the Yellow slide material here. Brachial plexus. All right, this is a well-known one. A lot of people know this. Red trucks drive cats nuts, or Randy Travis drinks cold beer, but just remember to drink cold beer, especially after your midterm and you aced it because you were reviewing a bunch of mnemonics to help you remember. It just represents roots, trunks, divisions, cords, and branches, or nerves, depending on which mnemonic you use. Next, retroperitoneal structures. For my class, this is mostly FYI, but you never want to be the old sad pucker. This is another one that I like. This is a well-known one that everyone remembers just because who wants to be a sad pucker, huh? Go right down the list there. Pucker, and you have various retroperitoneal structures as opposed to intraperitoneal or infraperitoneal in the pelvis. Another one, bouncing back into the orthopedic world. This is actually my world here. The rotator cuff muscles, again, for our exam in my class, this is mostly FYI. Not going to be covered, but if you imagine grabbing your hand over the head of the humerus, you can put your fingers down and represent the rotator cuff muscles, subscapularis, supraspinatus, infraspinatus, and teres minor. How about sort of related to orthopedics, but not exactly. It's just a general anatomical structures list in the cubital fossa. This one's fun. I really need beer to be at my nicest. I'm not saying, I'm reading the mnemonic. I'm not stating something about my own personality here. From lateral to medial, radial, nerve, biceps, tendon, right? Really need beer to be at my nicest. Brachial artery, median nerve. This actually really helped me when I was in my early days in doing my first blood draws, all right, venipuncture, kind of knowing, all right, where am I going? What do I want to make sure as I'm trying to draw blood here, not to go a little too medial or not to go a little too lateral for fear of hitting artery or nerve. So that is actually very useful. And rounding this off, the last random mnemonic of the day to help you for the midterm, right versus left, right? As this picture represents here, looking at the heart and the great vessels going up and down. Aorta and right, both of these words have 5 letters, so aorta is on the right. And how about that? Vena and cava are on the left, and left, they all have 4 letters to these words, so vena cava is on the left, just like this picture represents. Vena cava on the left, aorta on the right. Easy way to remember. But there's something wrong with that mnemonic, and hopefully most of you have picked up on that. Think of your anatomic position when you are over the cadaver, or just imagining this if you're doing an online class and you're viewing the anatomical specimen. If a teacher or an instructor says, which side of the body is the aorta? Well, it's on the left of the body, but you're viewing it on the right when you're looking at the specimen in anatomic position. So that's it. Good luck on the exam. I'm going to leave you with AI generated images and pictures. This is actually a Scantron for those of you in the younger generation. You are not familiar with this because everything's online. This is what I did using a pencil and marking it. And I did a little, this time it was a little bit of impressionism and student exam taking, and I had AI generate that cool image there. That's actually what a Scantron looks like. Teachers would feed this in after all the students filled it out, and it would generate in a tiny little mini digital display there. This is way early days before iPads, laptops, and the like. That's what test taking was like. So good luck on the exam. I hope you do well.